Now we have the Navvus catheter sensor in the body positioned at the guide catheter tip. And you can see both pressure waveforms are displayed on the screen. The red is the patient's aortic pressure. The green is the Navvus catheter pressure as measured by the fiber optic transducer. You'll notice at the top of the screen it says ready to equalize. By pressing equalize, we're telling the system whatever that aortic pressure is, we want the Navvus catheter pressure to be exactly the same. And that will superimpose those two pressures on the screen. Now, with the physician's wire of choice in the body, we can simply advance that transducer inside the coronary artery to the area of interest, and we're ready to start adenosine. Once the patient gets that hyperemic response of the adenosine, we can simply hit record on the screen and we'll record that hyperemic response. You can see how the PDPA ratio was tracking the FFR the entire time. And when the FFR got to be the lowest, the system seeked out that value and placed that here under FFR. We're going to stop the recording, and now we have to make a choice. Do we discard that information or do we save that information? The white dotted vertical line shows you where the RXI sees the lowest FFR value and places it here. Well, let's go ahead and save that value. We'll go back to the live picture, and now that value is held here under our first FFR. Now we can go ahead and choose, if you want to do another recording. And we can stop that recording at any time. Now if we save that recording, that value will be placed in the second slot here in the FFR. Now it's always good to label what we want to call the vessel that we're in. Here we have a drop-down menu in which we can pick from. So if we were in a distal LED, we'll simply select that. Distal LED will be displayed here with our two FFR values. In the case you have an additional vessel that you would like to do an FFR in, we can go ahead and hit New Vessel. New Vessel will take us to Vessel 2, which is the default. We can go ahead and hit Vessel 2 and select the vessel that we're in this case an OM. Because we have a microcatheter on a wire of choice, we can easily go into the next vessel, get our fiber optic sensor positioned in the correct area, and we can go ahead and start adenosine once again. Then, once we're at peak and maximum hyperemia, we can record that FFR in that vessel. We can stop this recording at any time. We can save that FFR, and now we have an OM with an FFR of 0.70. Now at any time we can go to case summary, and here is displayed the LED and the OM FFR.